Hi, this is Dr. Pat, and this is going to be the first of several videos I'm going to do about testosterone and testosterone replacement therapy. Today I'm going to talk about how to know if you actually have low testosterone. Most of us already know intuitively what the signs and symptoms of low testosterone are, and they can be summarized in the picture that is shown here. But don't forget, there are all sorts of reasons for feeling blah, including poor sleep, depression, anxiety, stress, and one of about 1,000 diseases. So always check with your family doctor before thinking about going on testosterone. One of the ways of helping decide if you are low on testosterone is called the ADAM questionnaire. ADAM is an acronym for androgen deficiency in the aging male, and the questions are as listed on the right. A positive questionnaire is a positive answer to item number 1 or 7, or any other 3 questions combined. If you have a positive ADAM questionnaire, there's about an 80% chance that you have low testosterone. Lab tests can be done on blood or saliva, and the way that the lab decides what is normal is statistical. They choose the values that include 95% of the population. For example, if we were discussing height, from here to here would be the values which include 95% of the people. There'd be 5% outside these limits, which would be 2.5% over here and 2.5% over here. And they do the same with testosterone. These are the Canadian units here, where normal testosterone level at the low end is 10 and the high end is 30, and the US units are underneath. So to officially be low on testosterone, you have to be in the lowest 2.5% of the population over here. But what about this green fellow here? Well, he's not officially low on testosterone, but he certainly is low-ish. And I have a lot of young men who aren't officially low on testosterone, but say they feel as if they're low on testosterone. And I tend to believe them because a lot of them have actually had a testicle removed for testicle cancer, which is one of the most common cancers in young men and is almost totally curable. So guys, check your balls. There is a daily fluctuation in testosterone levels, so testosterone is best tested first thing in the morning. The labs that I work at, they won't even draw your blood or take your saliva if you show up after 11 a.m. It has nothing to do with eating though, so you don't have to starve yourself. With only 2.5% of the population officially being low on testosterone, you might think that it's fairly rare. But as you can see from this graph here, over the last 50 years, testosterone levels have been declining dramatically. This is probably due to what's called endocrine disrupting chemicals in the environment, plastics, chemicals, and that sort of thing. And they're having a dramatic effect on men's testosterone levels. So I included this graphic here just to illustrate a point. Kirk Douglas and his son Michael Douglas and his son Cameron Douglas. They look like Kirk has by far the highest testosterone level, and then next highest is Michael and the lowest is Cameron. And that probably is true for most of us. Our fathers had higher testosterone levels at our age than we did, and our grandfathers even higher. A lot of young men just think of testosterone as a way to bulk up in the gym, and a lot of older men just think of testosterone as a way of becoming younger men. But those are somewhat frivolous reasons to take testosterone. However, there are health benefits to taking testosterone because having a good, healthy testosterone level actually improves overall survival. So to summarize, testosterone has definite signs and symptoms which, although somewhat vague, can be helped out by doing the ADAM questionnaire. If you still think you have low testosterone, go and get a blood test. Many people have low or lowish testosterone and would benefit from replacement, especially since testosterone levels are declining over time, possibly due to environmental pollution. And maintaining an adequate testosterone level is genuinely healthy for you. That's it for today. If you have any questions or comments, please leave them below.